Hello, Dayna Johnson, your Dentrix office manager. I'm here today with Janice Hurley-Trailor, and we're at the Speaking and Consulting Network in Charleston, South Carolina. And Janice is dentistry's image expert. She is fabulous for turning people into these amazing human beings. And today we're going to talk a little bit about some tips for your practice. So Janice, a couple things that I see, one thing that I see in my practice sometimes is the financial coordinator, the office manager that may go back and forth between the back and the front. And so she may be wearing scrubs all day. And then she has to do that treatment plan presentation. Give me your take on that.
Yeah. I think a lot of times that person is called the rover, right? They want to make the best use of the person's skills front and back. But in reality, if they looked at their schedule and they saw how much time she spent in the back, it might be less and less important than what's going on in the front. So I often suggest, if that's the case, that she just put a lab jacket over her professional attire up at the front desk, because being able to close that treatment case is really very important. The reality is none of us have much presence with the person we're speaking to if we're wearing scrubs, Horrible, even worse if they're pink or they've got flowers on them or little teeth or bunnies, right?
Yeah.
It's much worse. So that professional presence up at the front desk makes the practice money.
So I've heard you mention that maybe they could just go to like a TJ Maxx or maybe and buy a jacket to go over their scrubs.
Yep.
Do you have a suggestion as to a color, or what's the best color, do you think, for a front desk?
I actually suggest that they not wear it over scrubs, but that they're dressed in professional attire in the first place.
Oh, okay.
But if they were going to make an investment, the best thing to do would be to do a little blazer or a jacket. And you can get these high quality but very inexpensive for somebody that's interested in doing this, or an office that's interested in investing in their team and making that transition between scrubs. TJ Maxx, Marshalls. Get a higher quality item, but buy it at a discount store. That would be the best thing to do.
Great idea.
And I often suggest a solid color, kind of like you and I have on, because you could wear that black over all kinds of patterns, sleeveless dresses, sleeveless blouses, if you live in an area that's warm. Sometimes team members say, well, we live in the South or we live in Arizona where it is too warm, when in reality, we all work in offices with air conditioning.
That's true.
So a little blazer over whatever it is that you're wearing, you could even wear that with pants. It communicates a sense of authority. The reality is all of us make decisions about each other within less than a tenth of a second. So those patients are deciding whether that treatment coordinator is somebody that's got the authority to make the good decision.
I've heard you talk about how important the person that answers the phone, they're like the lead into the dental practice. So give me your take on that.
I think
Expand
it is
on that.
crucial to change our attitude in terms of how important someone is that answers the phone. It used to be that they were just the secretary or they just answered the phone, right? When in reality, I think the person with the highest self-esteem, best verbal skills, the most confident, should be the person that answers the phone, because they're the very first impression of the office. And without that good impression, the patient may never come and be able to get to meet and see the doctor in the first place. My experience is, Dayna, that sometimes the doctor that's the most interested in elevating her or his clinical skills attends all these advanced CE courses and is really used to getting the best technology, and they forget about that person at the front desk that I think often should be the highest paid administrative person that you have.
Yeah, first impressions.
Lasting impressions.
First impressions are so important.
Yeah.
And I've also heard you talk about that when when the doctors are interviewing for the person that's going to be answering the phone.
Yeah.
How important that is.
And the reality is we usually, in a hiring process, look at their resume, decide if they're going to be a good fit for the office, and then we call them. And it really should be the doctor himself or herself that listens to the voice tone and the pace and the grammar. I've had numerous offices ask, how can we change the grammar? Can we teach them to speak slower? And you or I could improve our verbal skills, but it's very hard to ask somebody else, and actually even not very fair if we're now wanting them to change the way they naturally talk, or if they naturally interrupt. The way they were raised at home, the way they heard conversations. If you're now hiring somebody that's 30, 35, or maybe even a little older, it's really hard and not very fair.
Good points. Great. Thank you. So if our audience today wanted to get in contact with you, hire you for an evaluation or a consultation, how can they get a hold of you?
My website is just my name, so www.JaniceHurley-Trailor, and it has all the information that somebody would need to get hold of me. Also, descriptions of the courses that I teach at different conferences and the availability that I have. So that would be great.
Great. Her website is fabulous. So her website's wonderful. It'll give you a little insight into her personality. So thank you. Thank you, Janice, so much.
Appreciate it.
All right.